All right. We now have our next speaker who will be delivering a keynote address. Dr. Sue Archbold is a teacher of the deaf. She's the coordinator for KICA and she works in the World Hearing Forum and the European Symposium on Pediatric Cochlear Implantation. She feels passionately about requiring greater access to the cochlear implant technology for all those who could benefit from it. She managed the Nottingham cochlear implant team for the first 15 years of its existence. Her aims are to raise expectations of what the difference the cochlear implant can make for an individual and, of course, society at large. I would like to welcome Dr. Sue to give her keynote address. Welcome, Doctor.
Thank you very much. It's absolutely delightful to be here with you all. It's early in the morning here in the UK, and I've been up early to join some of your sessions, and it gives me great pleasure to round off this exciting few days that you've had. You say together we can. I'm going to say together we will, and we need to look to the future. I'm delighted to be here sharing this and the invitation from V-Connect Foundation. I'm now the coordinator of the Cochlear Implant International Community of Action, and V-Connect are great supporters. KICA, as we call it, is proud to be celebrating our first anniversary next week on the 25th of February, which is International Cochlear Implant Day. But I'm not just going to talk about cochlear implants, although of course they've been a revolution in my lifetime for profoundly deaf children, as we know. But I am going to talk passionately about how we manage hearing loss for children and how effective we need to be for families, because families and parents are key at the centre of children's lives. One surgeon I talked to and worked with, Jerry O'Donoghue, for so long, said that the most important thing that you do in life is to choose your parents. We can't, of course, do that, but parents are absolutely key. And I have been to India several times and have really enjoyed my times there working with SiGiCon and also working with Neelam Vaid in Pune. So on we go. We do know that the many technologies that have changed life-changing opportunities for deaf children. I've been a teacher of the deaf for many years and taught profoundly deaf children before the advent of cochlear implants, and have seen the changes that have been made. But it's not just about cochlear implants. We have newborn hearing screening, we have digital aids, we have auditory implants, of course, we have assistive listening devices, and we've got changed communication developments. Here we are, I'm sitting here in my dining room in England, talking to you via Zoom. We wouldn't have dreamt of that several years ago. But let's just stop and reflect on the impact of deafness in childhood that so many of you know about so well. We know about delayed communication and language skills, about poorer educational attainments and employment prospects, because hearing is key to communication. And for children, hearing is key to spoken language development within the home. We also know that up to 40% of deaf children will have another difficulty, such as a language learning difficulty. We also know about the impact on social and emotional skills and on the family. The diagnosis of deafness for many families comes as a great shock. One parent said to me, at first it was really hard to actually talk as normal to her, knowing that she couldn't hear us. And another mum said, we actually stopped. I stopped smiling. I stopped laughing. Moving on from those early times, for parents, their biggest issue is often education. And we do know that if newborn hearing screening takes place, and we know you've been talking about that too, we can give access to this spoken language of the home from the first weeks and months of life through hearing aids and cochlear implants. A huge change from when I first started teaching deaf children, when diagnosis commonly took place at the age of 3, missing valuable time. So now With early access to spoken language development, we can have increased language levels, increased access to mainstream education, increased educational outcomes. And today, the majority of profoundly deaf children in high-income countries receive implants, and increasingly in low and middle-income countries. But in life, there's always a but. What do we know about the long-term impact on families and children? Well, as I said, you've said, together we can, and I suggest together we will. And why and how can we move on? At the bottom here, you'll see two young people with cochlear implants advocating for themselves and for their peers at the World Health Organization. But the possibility of this exciting technological and scientific developments in ear and hearing care are wasted unless we can deliver lifelong, sustainable support services. And sustainable is really important. Many parents led the revolution for screening, for hearing aids, for cochlear implants in India and elsewhere. Parents leading the battle for provision. Their children are now young people with their own lives, like these two young people here. They're experiencing new challenges, and we've got an obligation to these young people who are advocating for their futures. There is a lot of talk always about early intervention and early work, which is of course so important, but we need to think long term. And I know that you in this conference have been thinking about teenagers and the challenges that they face in today's world. And we need to increase access to ear and hearing care for a lifetime. As Nalim Vaid said in her talk at one of our Kicker Live events, the Indian paradox is that a country of over 1.3 billion with a rapidly expanding economy, you have a growing middle class, but you still have millions below the poverty line. And the challenge you have balancing today's technology and access to today's technology with the needs of a developing country. You can see Neelam's presentation as part of one of our Kicker Live events if you visit our website at kickernet.org. So advocacy is needed to move things on because great things have been happening in advocacy work, which we can use with governments to influence their decisions. We can use globally. You can see here the picture of the first World Hearing Forum at the World Health Organization in December 2019, and it's been a privilege for me to be involved in it. We launched the World Report on Hearing in 2021, an exciting event with a lot of useful information for all of us. We celebrate World Hearing Day every year on the 3rd of March. Last year, 700 activities worldwide. Have a look on the World Health Organization's website. And what are you doing on World Hearing Day on the 3rd of March? We also launched the Cochlear Implant International Community of Action, KICKR, and the World Health Organization have also launched their screening handbook. And I know that you've been talking about screening and trying to move it on. Screening for newborns, for school ages, and for the over 50s. Screening for adults, another important area. Now, the World Report on Hearing, it's evidence for lifelong ear and hearing care. What does it say and what does it tell us? Well, the report makes it absolutely clear that deafness and hearing loss is a challenging global health issue and a social issue that must be tackled. The Director General said, we can no longer afford to turn a deaf ear to hearing loss. If unaddressed, hearing loss can negatively impact on many aspects of life: communication, the development of speech and language in children, cognition, education, employment, mental health, and interpersonal relationships. At last, the World Health Organization is actually publishing evidence to help us drive forward the care that is needed for those who are deaf or have a hearing loss. deafness and hearing loss is so often unrecognized and unseen, and its impact unrecognized, and along with that goes a lack of funding. The huge impact of hearing loss on children, adults, families, and society is recognized in the report, and this is a big step forward for all of us. So what does the World Report on Hearing say about cochlear implants? It says that cochlear implants is one of the most successful of all neural prostheses developed to date. The benefits of today's technology, specifically including cochlear implants, are recognized as part of ear and hearing care right across the life course. This is huge support in all of us in our work and when we are trying to persuade government officials to fund more work for hearing loss. The report says that cochlear implants are electronic devices especially useful when a conventional hearing aid has little or no benefit. It says, in children, timely intervention with hearing aids and implants leads to better hearing, spoken communication, and quality of life, which further translates into better educational outcomes. It also says we should improve access to high quality, affordable hearing technologies and the services required for their effective use. And this is really important. Cochlear implantation must only take place where the supportive infrastructure for rehabilitation therapy exists. So we shouldn't be carrying out cochlear implants and striving for access to cochlear implants, looking at the surgery as the beginning and the end of it, but we should be looking about a lifetime's use. And I know that you've just been hearing from all the industry partners about what they provide for the lifetime's care. Now, the World Report on Hearing is a long document, 250 pages, and we have, at KICA, we have provided a briefing paper here, Children's Cochlear Implant Advocacy, which you can actually download. It summarizes the evidence for you so that you can easily access the bits that you need when you're trying to present evidence and work and with advocacy with governments and with politicians. With children with cochlear implants have a greater likelihood of acquiring oral language. Their use in children with severe degree of hearing loss has brought substantial benefits. Cochlear implants can also have a beneficial impact on learning and educational outcomes, as well as the overall quality of life. These briefings are available from KICAnet/resources, and you can translate them if you wish. So why is cochlear implant advocacy work important now, as well as advocating for all ear and hearing care? Well, despite WHO recognizing cochlear implants as one of the most successful neuroprostheses developed to date, they also note that their uptake has been limited with considerable variation and lack of take-up by those who could benefit, including those in high-income countries. We do know that the gap between those who could benefit from cochlear implants and those who receive them is huge. So there's a huge gap that we need to address. And WHO also says, with cochlear implants, there's limited research and data on access and factors limiting their use. And now, with the impact of the pandemic, and its impact on services globally, cochlear implant advocacy is needed more than ever. The economic case for cochlear implants has also been made. The unaddressed hearing loss imposes a global cost of more than $980 billion annually. The cost of doing nothing is one we can't afford. We recognize, of course, that cochlear implantation is an expensive business, but it's been proven time and again that investing in cochlear implants in children actually saves society money over time. We also recognize, of course, there are particular challenges in countries like India and Africa for our spend to save arguments and for funding. But still, the economic case has been made if it's managed well. Brian Lamb and I carried out a global consultation 2 years ago of users, families and professionals about what were the barriers to cochlear implant advocacy. There was a recognition of the issues with access to cochlear implants and lifelong care. The barriers to cochlear implants globally were seen as a huge lack of awareness of hearing loss, and we really need to do something about that still. Lack of referral guidelines, lack of finance for the long term. There was a recognition that the time is right for the power of advocacy groups and individuals, the voice of the user. For groups like vConnect Foundation, Kicker brings together a network of networks. The voice of the user and the family needs to be strong to strive forward to get the services that those who are deaf and have a hearing loss really need and deserve. And as one person said, the only chance of success for change is the advocacy voice. Use the advocacy voice with the policymakers to influence decision makers. It's too professionally based. They forget the user end of things. They forget the families. So we established Kicker, which is a network of networks, to develop a global community of advocacy groups and individuals to share activities, resources, collaborate, strengthen the user and the family voice, to provide cochlear implant advocates with the tools for change they need, and to increase the provision of cochlear implants and lifelong services globally. And we're delighted that vConnect Foundation has a huge participation. So this is the outcome. Here's our website. We're an energetic organization led by users. We're just coming up to our first birthday. We've got 75 organizations globally with 350 individuals, over 40 countries represented, 2,000 downloads of our tools for change. We have Kicker Live events and Kicker Conversations. A Kicker Conversation is for a small group talking about the issues that are important to them. And next week, we're having our next Kicker Conversation, which is for 18 to 30-year-olds who wear cochlear implants. What's life like for them? What are their issues as they go to university and enter the world of work? Well, just when all this advocacy work for hearing loss was getting going, really for the first time, when you think about the huge steps forward at the World Health Organization, just when we were getting going, we had a global pandemic with an impact on hearing services globally. Access to services has been made more difficult everywhere. There's been an impact on communication, as we know, the wearing of masks, the screens, social distancing, people trying to isolate. Education has been disrupted online, greater cognitive load for children, huge global financial challenges for healthcare. And there's a danger that ear and hearing care drops down the line of importance. We need to make sure that after the pandemic, ear and hearing care gets right up back the agenda and is seen as important. And people are questioning public health decisions, and we need to question them too. There is some positives. There's a greater understanding of the challenges of communication by the public in general. Access to services can be easier. We're all using the technology with greater confidence. And that is helping many who can have remote programming, remote help. Because the long-term management of cochlear implants remains a big challenge still. It's not in the cochlear implant clinic. And actually, what I'm going to say is equally true of hearing aids. Hearing aids and cochlear implants are only effective if they're well used in the community. Some parents have said that their training for local educational professionals is by far the most common issue to be raised by parents and professionals in a survey we did, especially in mainstream schools, for teachers and classroom assistants. Managing this technology in a busy classroom where you have many children is not easy. The need for long-term management and parents saying they wanted support into adulthood with better local services. That was a survey I did in 2006. Have we learned anything since then? I often think not a lot. Supported by Oticon, we did another survey in 2016. Similar messages coming through from parents. Always, we had to fight for anything. It was a huge battle. I have to fight for the rights of my son constantly. It's assumed that because he wears a cochlear implant, his hearing is normal when it's not. We hear that again and again. Sometimes one thinks that cochlear implants work too well because the spoken language is excellent. It's assumed that the children can hear everything in the classroom, and in noisy classrooms, this is not the case. More professional help in the classroom, better teacher training. Now, here's an estimate of some figures of pediatric recipients of cochlear implants. And this is in Europe, but I suspect that the pattern would remain similar across the globe. So along the bottom, along here, we have from birth right up to 40, the number of recipients in each age group. This is not the age at which they were implanted. This is the age they are now. So not the age they were implanted. How old are our cochlear implant recipients now is the important thing I'm asking. And as you can see, 30% of them are under 10. And here we have, if we have a look, we often concentrate on this bit. We talk about what we're doing with the under 5s. We don't talk about what we're doing with this lot. And actually, over 20% of our implanted recipients are over 20. What are we doing for this group? Are we thinking about them? The majority of implanted children or young adults are over the age of 10, 70% over the age of 10. And if we look at them on this basis, if we have a look from the years of implanted at the bottom, so starting back here in the 80s on the left-hand side, up to 2019, I haven't gone any further because then we start the pandemic. But if we have a look at the orange ones, are those implanted each year. The blue shows us the cumulative figures. So as we continue to implant year after year after year after year after year, the numbers of implanted children, young people, continues to rise. What are we doing about this lot? What services are you providing for this group? We know what people are doing about the ones that are just getting implanted, but what about the rest of them? I continue to be concerned about that. And when we interview young people about what do they say their needs are about university and work, and here's a group of young people at a summer camp, typically what they say, my university is not deaf aware enough. They think because I speak, I can understand everything. If I was a signer, my needs would be obvious. A young person going into the world of work, my boss doesn't have time to talk about what I need. I need technical updates. What's new? How do these young people find out what the latest technology or the latest assistive devices are? And here, another thought. The fact that it can break down and the fact that sometime in your life, you have to have another operation to replace it. I need to talk to someone like me. These young people are all doing well at school, or most of them, but they want to talk to somebody else like them, who has the same challenges as they do. Are we listening? These young people must become their own advocates. When their children, their parents look after their technology, take them to appointments and so on. What happens as they grow up? And what families and young people want. Another study that we did, looking at, there were 600 respondents to this. For long-term cochlear implant users, we want a technical service that can be divided by the internet remotely. so that the team can spend the time more effectively on managing newly implanted patients. Remote programming of patients. Oops, sorry. Telepractice is used routinely as a service model in Australia. And of course, the pandemic has taught us a lot about how we can use telepractice very effectively and how we can use it with confidence in a much greater way than we did before. When we had a conversation about the impact on the pandemic on cochlear implant services, 3 themes emerged. We had people from 8 countries. Funding was a challenge, the pandemic debt. We have to be very aggressive concerning cochlear implant funding. Waiting times longer. Surgeries in many places stopped for a while. Remote service delivery, growing confidence by all. One person saying, this time last year, Zoom terrified me. Now it's just what we do. And professionals saying, we've become better at letting the patients and the families take control. So to finish with, all this wonderful technology we have, whether it's hearing aids or cochlear implants, we need to make it work in the community, which is where the children, the families, and the adults live. So we have access to the technology. We need to fit hearing technologies, program them in the clinic. Then learning to use the technology, learning to use the hearing aids, the cochlear implants with family programs, individual sessions, group sessions, resources, and then deliver it at home, at school, at work, because this in the community is where our children and where our adults with hearing loss function on a daily basis. How do we make all this happen, and how do we fund it? Too often, this is the bit that we talk about. We're getting quite good at this bit, but we're not good at this bit. So the technology revolution has happened. We've learned how to improve access and to make hearing services sustainable. Have we learned how to do this? How to improve access? How to make hearing services sustainable? Parents, young people, children expect to be partners and to be involved in hearing services and technology development. We need to work at greater awareness of the impact of hearing loss and what we can do about it today. The pandemic has forced us to think differently and provide new opportunities together with the new developments you've seen during this conference. And the strong advocacy happening in ear and hearing care by WHO gives us further opportunities to use. So together we can, yes, together we will. And we can move forward and make it the best time to have to be deaf or have a hearing loss with all that we can offer. And I'm very proud to say that vConnect will be represented by Vahashtai at our next cochlear implant live event on our first anniversary on the 25th of February, International Cochlear Implant Day. It's going to be on the impact of the pandemic on cochlear implant users, services and families. What have we learned? How can we move forward and ensure that cochlear implants, hearing technologies and ear and hearing care is at the front of the public health agenda as that we move on from the pandemic, and show how important communication is and how effective technology is even more than ever, looking to the future as you've been doing at your conference. So I wish everybody well, and maybe in the not too distant future, we'll actually manage to meet face to face again. And thank you for all that you all do. Thank you, everybody.
Thank you, Dr. Su. It was an amazing insight. And as you said, together we can and together we will. Absolutely right. Yes, together we will. And I also want to say that you all are doing an amazing work on such an important topic, which is sometimes not highlighted. So it's an amazing work by all of you. Thank you so much.
Thank you.